Good morning, everyone. Good morning, Queensland. First of all, I want to thank everyone in the Greater Brisbane area for absolutely doing the right thing. I know this is tough times, but I know that we'll all get through this together. So I can report that we have 10 new cases overnight. Now, 8 of these are community-acquired cases, 6 are close contacts of confirmed cases, and 2 are currently under investigation, but we believe that they are also linked to the 2 people. So 2 are also overseas acquired, and once again coming via Papua New Guinea. So we now have 78 active cases of COVID in our hospitals. We've had 14,589 tests in the last 24 hours. And can I thank Queenslanders for coming out and getting tested. This is absolutely critical. If you have any symptoms, now a lot of people in the Greater Brisbane area are at home. If you have any symptoms, now is the time to go and get tested. We need to rule out any further community transmission. But the good news is that these cases are linked, and we now believe that there are 2 distinct clusters. So we have a cluster linked, of course, to that PA doctor, and we have a second cluster linked to the PA nurse. So close contacts of both of those clusters, and Dr. Young will go into more details. Now, as I said this morning earlier, and I'll say it again, the majority of our cases are, of course, from overseas, hotel quarantine, but our hospitals have 78 active cases at the moment. Now, if we go back to the 20th of February, we had 5 active cases. So from the 20th of February until now, so just over a month, we have gone from 5 up to 78, and 63 of those, 65 have been overseas acquired. Now, of course, we want to get on top of this community transmission. So the steps that we took to go into this lockdown, as you can see by those numbers of community transmission today, was absolutely the right call. So I want to thank Dr. Young for providing us with that advice. Now, there will be some new mandates coming into effect in terms of health professionals dealing with these COVID positive cases that Dr. Young will talk about, but already 41,000 of our frontline health workers and people looking after hotel quarantine have been vaccinated, which is around 89%, and we expect that to be completed over the next 48 hours, so in terms of getting that first vaccine. So the rollout of the vaccine has been happening, so I just want to reassure Queenslanders about that. But I'll now hand over to Dr. Young, who can give you some more details. Of course, there will be further lists of venues as our contact tracers go into overdrive to really look at where people have been. And I want to thank each and every one of them because they are doing an outstanding job. But Dr. Young will now go into more detail about these 2 clusters and give you more details. Thank you.
So we've had 10 new cases overnight. 6 of them are locally acquired cases, 5 of them related to the second cluster, which I'm going to go into detail in a moment with. 1 we're still working out which cluster they're related to, but we know they are a contact of a case. So we have 6 linked locally acquired cases, which is good. They're all linked. Then we have 2 cases that were acquired overseas and detected in hotel quarantine. So both came from the Philippines via Papua New Guinea into Queensland. So they're fine and being managed. Then we have 2 other cases that are under investigation. So we're just working through those cases. We believe they're older cases linked to the first cluster. So now if I can go into detail about these 2 clusters. So the first cluster is related to that doctor at the PA hospital who treated a confirmed case, and you would remember that she acquired it from a confirmed case in the hospital, and also that case had passed it on to another traveller in the hotel when they were in hotel quarantine. So there were those 3 cases earlier in March, 12th of March. Then since then we now have these new cases that we picked up in the community, and I'm very grateful to that first young man who came forward and got tested, and the second gentleman, so they live in northern Brisbane. So those 2 cases. Then we've had other cases connected to those. So, and we know they're all linked because of the genome sequence. They're all a B117 linked back to that case at the PA hospital. So we have that cluster. Then we have a second cluster, and this is the nurse that I told you about yesterday. So she worked at the PA hospital on the 18th of March in the COVID ward. But we now have the genome sequence result back due to some fantastic work by our pathology staff. They gave that result to me last night, and she has exactly the same genome, no SNPs different, to a gentleman who arrived and was treated in the PA hospital and was tested on the 22nd of March. So after the nurse worked in the COVID ward. She did do a shift on the night of the 23rd of March. So that shift started 10 p.m. that night. She worked through the night into the next day on the 24th. So my hypothesis, and this all has to be tested, this all has to be checked out, this is very preliminary information, is that she has acquired the infection when at work that night. Now, I don't know whether she's got it directly from that patient because she wasn't working with COVID cases that night, but we have to confirm that, or whether she's got it from someone else in the hospital. All that has to be worked through. But we do know she's got exactly the same genome, so we can't find the epidemiological link at this stage. That's the work we are now doing. So she has got it. Then her sister has got infected with the same genome. So we have that genome sequence result last night as well. So we have the nurse, her sister, and that overseas traveller, all with exactly the same genome. Then there are a further 5 cases that I've been informed of overnight linked to that nurse or her sister. So they're all linked cases, and they all attended a party together down in Byron Bay. So we're just working through all of those specific details. This is very recent information. So we have those 5 cases linked to that nurse. So we now have 7 in that cluster. Then there is another case. Remember I told you there were 6 new cases overnight, community acquired, 5 of them linked to that nurse in that cluster. Then there's another case that I still need to get more information, but I've been told is a close contact of a known case. So we don't have community transmission out there that we're not aware of. At the moment, all of our cases are linked to either the first cluster with that doctor who worked at the PA, or this second cluster, which is a brand new cluster unrelated to that first cluster, linked to the nurse who's worked at PA. So we understand all of those movements. But we've had a lot of people now out in the community infectious. So that's why we need this 3-day lockdown to get on top of all of the contacts of all of these positive cases and work out where they've been, and having everyone in their home instead of out and about in the community just helps us get on top of all of the contacts and minimise the risk of further spread. But we know we have had infectious people in the community, so that is why it is absolutely critical that anyone, anywhere in Queensland, because we do know that some of these people have left Brisbane, so it is vital. Anyone in Queensland with any symptoms, please come forward. That is critical. So we have seen that happening across the state, and we have seen a rapid escalation in testing numbers, which is fantastic, so we can find if we've had further spread anywhere. It's very confusing. I apologise. It's extremely excusing. Yes, they're all back in Queensland. They are all in Queensland. So I spoke as late as this morning to my colleague in New South Wales to go through all of that. My colleague in New South Wales, Dr. Chant, is working with her team in Byron Bay to make sure that they're sorting out all the venues there and contact tracing. I don't know. I've got to get more information. Yep. So there are, yep. Thank you for bringing that up. You've been listening very carefully. So there are 2 cases that I believe at this stage, but I do need more confirmation, are linked to the first cluster, and they are positive on serology. And people might remember that serology is not an exact science. You do have a lot of cross-reactivity, so we've just got to do some more work on those 2 cases. They're PCR negative, so they are not currently infectious, but they are reactive on serology, and they are close contacts of people involved in the first cluster.
And the other outstanding one, we don't know which cluster.
No, we don't know, but we know they're a close contact. You're getting this information almost at the same time I get the information, which is why I apologise I don't have all the answers. Correct. Correct. I don't have that yet. That's all the work that we now have to do. So I found out about this. It was a little bit of a surprise, but as I said yesterday, until we got the genome sequence, I couldn't be certain how that nurse had been infected. And then I got that late last night. Yes, very good question. They are both clusters are B117, or commonly called the UK variant, but they are very, very different. They are not related to each other. They are 2 different virus genomes. Yes, I can. So I've initially got 3 cases related to the PA doctor back earlier in March, right? Then I've got an additional 5 cases that are confirmed that are related to that cluster. Then I've got 2 more cases that I'm investigating that I suspect are related to that cluster, right? So that's 1 cluster. Then my second cluster, I've got 7 confirmed cases related to that cluster, plus, of course, the original case who travelled from India that has led to that cluster. So 1 plus 7. Then I've got another case that's one or the other cluster.
But the correctly, March 18, the nurse worked in the specific COVID.
Sorry?
So on March 18, the nurse worked in a COVID.
Yes, but I don't think that is the cause of her infection. In fact, I know it's not. So it's not that shift that has led to the infection. It's when she worked there on the 23rd.
Sure. Having said that, 89% of frontline workers vaccinated. Is it best practice for nurses who aren't vaccinated to be working in COVID?
So as of tomorrow, I will mandate, as I've been saying now for several weeks, to the hospital and health services that only people who've had their first dose of the vaccine, whether it be Pfizer or AstraZeneca, can work directly with confirmed cases of COVID. Yes, and that was always our plan. So we did set ourselves that target for between 4 and 6 weeks to get all of 1A workers vaccinated. We've reached that. We believe we'll have finished that by tomorrow. And then the plan was always, once we had people vaccinated, because we needed to have people available to look after all these cases. And as you heard earlier, we've gone very, very rapidly from 5 cases in just over a month to 78. So we need staff to look after these cases. And I'm very grateful to the staff who have been doing this work. Of course I am, and all of us are. And now all of those staff will have had the opportunity to be vaccinated, so it will be mandated that only vaccinated staff can work directly with COVID-positive cases. Because we didn't have enough vaccine. We had to roll the vaccine out. It's just so unfortunate that this outbreak has occurred when it did. Another month and all of these staff would absolutely have been protected. She wasn't managing COVID cases. There's a difference. I don't know. I found this out late last night. That is the really important work that the staff are all doing today. Yeah. No, they've done their best to do that. But as you've heard, the numbers of cases has just ramped up at the same time as we're trying to vaccinate people. So we've had to then vaccinate more people. So we started with a smaller number in 1A, and that number has increased because we've seen this big increase in case numbers. So the PA has been doing an absolutely first-class job, as has all of our hospitals. No, there isn't a concern, but of course we are looking at this and how it's happened. But as I said before, I don't know how the transmission event, because it's too early to know. It's not because we haven't looked, it's just too early. So I found out very late last night the genome sequence result. That was quicker than I thought. I thought I'd be getting it this morning, so they've done a first-class job there. And finding that out last night, we've then been talking to the HHS to go and test all the staff in that area to see if there's been another case or if there's been direct transmission from the patient to this nurse.
There is a report this morning that a contract nurse was tested positive visible as well.
That's correct. Yes, so one of the... No. Thank you for raising that. One of the positive cases in that second cluster attended the Hens party as an entertainer, and he came back and he lives in the Gold Coast and he works as a tradie, and he did go to an aged care facility in the Gold Coast. But every resident in that aged care facility has already been vaccinated, had their first dose. I haven't got confirmation about whether any have received their second dose. He's one of those 5. That's correct. He's one of those 5. So we're working with the Commonwealth to respond to that aged care facility. The team down at the Gold Coast are organising to go to the facility today and vaccinate the staff of that facility. Yes. Oh, I'm not sure. I haven't got that information. The majority, it's only the first shot. But we know that the first shot of either the Pfizer or the AstraZeneca gives you quite a bit of coverage. But most of them will be only the first shot because... Thank you. We have them, yes. I don't have them on me, sorry. It's too early to decide what may or may not happen. We'll just have to see how many cases we have and whether or not they're linked and whether or not they're in quarantine at the time that they're diagnosed.
Given we're so close to Easter, people really don't know what to do. And presumably the council will be for that stuff. Can you give us a certainty?
In terms of the Greater Brisbane region, we just have to take this day by day. I said that we will give the most up-to-date information we can every single morning, and so far the fact that we have these cases that are linked is good news. That is good news. Do we expect to see more cases? Probably. Probably we will see more. The big question will be whether or not we see unlinked community transmission. So it's a day-by-day proposition, but that is why this 3-day lockdown is absolutely necessary, as Dr Young advised, so our contact tracers can get on top of this as quickly as possible.
Would it not be wise to give people certainty to maybe extend it right through until Tuesday?
We can't say that, Lane, with all due respect, because it depends on what we see over the next 24 to 48 hours. My understanding was that was at Byron Bay, and my understanding was it was at a house, so it was contained at that house. We haven't had any positives linked from any of those other regions yet. Yep. My understanding is we get those updates at National Cabinet, and the next National Cabinet meeting is, from memory, next Friday week. Yeah. I might get the Health Minister to address that, but I understand that they're getting more supplies out to people, out to the different regions. Look, this is just really important because we do know that some of these people travel to other parts of our state. This is precautionary, and I really want to thank Queenslanders for masking up and doing the right thing here. And like I said, this 3-day, lockdown, it's swift and decisive, but it's so our contact tracers can get on top of it. And as you can see, we've actually done the right thing because we've had those eight new cases of community transmission today.
We really don't have any people actually at this time.
We're trying to get that information, so we'll be able to update people on that. We'll have to get that information. Yep. I might just hand over. Sorry. Yep. Yep. This is progressively being rolled out. It does depend on supply, and I was down at the Gold Coast, as a lot of other people were down at the Gold Coast recently when they started the rollout of the second vaccine, and they only found out that day that the supply had come in. So you're taking people off shifts to go and get the vaccine, you need to have the supply there. But like Dr. Young said, we expect our frontline health staff to get that vaccine first dose completed by tomorrow. Sorry? Look, we're rolling this out as quickly and safely as possible, bearing in mind that people are still doing their shifts and working in hospitals, and it is our priority to continue the rollout of the vaccine. So, look, I'll hand over to the Health Minister and our Deputy Commissioner. Thanks, Yvette.
Thanks, Premier. In relation to the vaccine, first of all, the amount of vaccine that we have been supplied by the Commonwealth did not all arrive on the first day. So it has progressively increased, just as our vaccinations have progressively increased. And in fact, we did 6,004 vaccinations yesterday, so that is a record number of vaccinations. And we've done 65,129 now. So 65,129 as of yesterday. So every day we're increasing the vaccinations, but we had to wait for consistency of supply. Also remember, we also had to keep some in reserve for the second vaccination, because particularly around Pfizer, so the majority of all of our 1As had the Pfizer. So certainly in those 6 major hubs, they all got Pfizer. We have to hold back enough Pfizer to give them their second vaccination, because we can't be sure, and even the Commonwealth can't be sure, when that Pfizer delivery is going to come to Australia, and also when it's going to get out to the individual states. So we don't want to vaccinate all of these people and then turn around and say in 21 days' time, sorry, we can't give you your second vaccine, we don't have enough. So there's a whole lot of logistics. The Commonwealth are holding a lot in supply as well. This is something that every jurisdiction's doing. We have to do it, and until we get the CSL AstraZeneca out to every state on a weekly basis, we have to be careful to make sure we manage the vaccine. So we've done that. In relation to 1A, we originally factored for 37,000 individuals to be vaccinated, and in fact we've vaccinated 41,472. So as our demand has grown in relation to COVID positive patients, so has our health workforce in the 1A group. We've had to increase that group. So 41,472 have got the first dose in 1A, and 4,918 the second dose. Now, that's as at the 25th of March. So we are, over the last week, we have given over 20,000 vaccinations. So we are ramping up very quickly now, and 6,000 yesterday. So that was 6 days ago, almost. And so consequently, 5 days ago, so consequently there's been quite a few since then. So we are at that critical mass point where we now can say to all of our hospital and health services, as of tomorrow, that we want you to confine the health workers who work with COVID-positive patients to those who have had their first vaccine. We are finally at that critical mass. We said we were looking at doing that in 6 weeks. That's what we've done. And we've done that despite we've increased it another 4,500 people to get vaccinated. So I want to be really grateful to all of the staff who have made that happen with the vaccination centres. Inevitably, there'll be staff who are on leave, and this nurse at the PA actually had been on leave for a month, was due to get her vaccine this week. So there is always going to be those who are on leave, who are sick and for other reasons hadn't come forward and got vaccinated yet. And we are identifying all those people now so we can get them vaccinated. But irrespective of whether they're vaccinated or not, we'll get to that point as of tomorrow that we have to use only vaccinated staff.
Is that too late though? If she was on leave, why
The reality is that we have a large number of positive cases in our hospitals now. So you do one of two things. You put in place a protocol that says we are only going to use vaccinated staff and reduce the number of staffing we can use that puts us all at risk. If we are having less staff available to manage COVID patients than what is safe, then that puts everyone at risk. That certainly increases risks of transmission because you don't have enough staff managing these patients. So we can't afford to take that risk. Every state has had to do it this way. The reality is we had to wait till we're at critical mass. The whole country isn't at critical mass yet. The fact is we are not fully vaccinated. COVID is still real, it's here and it's on our doorstep. This is another reminder of that. We're fortunate we're at that point now that we'll be able to bring that protocol in, but to say we could have done that 1-2 weeks ago would have meant we're putting our staff at risk and the patients we're managing because we wouldn't have had enough staff vaccinated at that time. Well, as you've heard from Dr. Young, the shift she did on the 18th, it is clear she did not get the virus on that shift. As I say, she was scheduled to get her vaccination. We can't vaccinate everyone on the same day. They're all booked in and we are due to complete that cohort this week. So the reality is we can't vaccinate the whole population all at the same time. We've done this, we've ramped it up, we've done extraordinary numbers over the last week. We planned on hitting 20,000 a week by mid-April. We did that last week. We got 6,000 yesterday. So we are ramping up very quickly as the vaccine numbers have increased in our delivery to Queensland. Look, I'm not aware of that. I'm happy to follow that up, but I'm not aware of that at all. No, she was due to get vaccinated this week, as I understand. Well, as I say, the protocol, as in all health workers in 1A being vaccinated who work with COVID patients, will come in tomorrow, now that we've hit that critical mass. We'll, of course, have a look at what's happened here at the PA hospital. We want to understand how this transmission's occurred. Every time we get a community transmission, we want to understand how this has occurred. But as Dr. Young said, it's still very, very early days. We've only got that serology overnight and we're still doing all of those investigations.
The AMA argues that the masks aren't being properly fit tested. I mean, I know it's that stands the right to have, are they not being fit tested properly?
I'll just ask Dr. Young to address that.
Yes, so there is a process in place for both fit testing and fit checking, and that's something that's in place in each hospital with positive cases. But the risk here is just that we've had such a rapid ramp up in cases. So all of that's being worked through with all of those staff. It is very important that they have access to the right PPE, which they do, they have the right training, which they do, and they're vaccinated. So they're the three things that we've got to make sure are in place.
If they're not getting fit tested enough, is that a suggestion that they are not getting that fit tested at the time?
I don't have the data on how many have been fit tested and fit checked. That just needs to be in place, and that's what they're the hospitals are doing.
You said on Sunday night you didn't sleep, and you said yesterday you were very, very nervous.
Yeah.
Given these figures today, how do you
Yeah, well, everyone's worried. Let me take this off. Sorry, everyone's worried. You know, but the good news is that so far, so good in terms they are linked. What we don't want to see is unlinked community transmission out there. So, you know, like I said, the next 2 days is critical for our contact tracers to get on top of this, and it is really important if anyone out there is feeling sick and has any symptoms, please go and get tested. We need to eliminate any unlinked community transmission out there in the community. And I want to thank people for going out and getting tested. When I drove in this morning, there were queues out at South Brisbane. People are coming out and doing the right thing and getting tested, and that's exactly what needs to happen. I might just hand over to the Deputy Commissioner. He hasn't had a go yet, if that's all right, Lydia? Yeah.
I'll just give you a very quick update on our operation in support of the lockdown, and once again the Queensland community has stepped up. The levels of compliance and buy-in to this has been quite extraordinary, so we thank you for that and ask you to keep it going. So of all the intercepts that we've done, and I won't go on the figures, but we've seen something like 26 calls for service, a number of intercepts, street checks and the like. No pins have been handed out at this stage, and in fact all the calls for service we had have been largely around reports of people coming out of affected areas and checking on them, and in all instances they've been compliant. No reports of parties and the like, which is very encouraging. We've handed out 216 masks to date, and we'll continue to do that, so we're working with our community to make sure that they can do the right thing. We've seen one arrest that's related to COVID, but I have to say that that person was intercepted in Brisbane City last night for serious criminal offences, and during the arrest decided to cough on police and has been charged with a serious assault as a result of that. Finally, I'd just like to say it's very important that our community understand that if they're planning to travel for events over the Easter weekend, even though we may not be in lockdown then, you cannot travel for that purpose in the lockdown period. It's the 4 key reasons that people have to travel. We are working with event organisers across the state to make sure that they are across all the details they need to be, and indeed where they're ticketed events such as the Rocky Nats, we are contacting people that are planning to go there so they know what to do. Thank you. Well, we know that the lockdown at this stage is planned to finish at 5 p.m. on Thursday, which of course leads into Easter. People really need to know what's required of them. At this stage, you cannot travel before that period should the lockdown end. They need to stay connected to see what's going to happen. But of course, a lot of people leave before the Easter weekend, so they can't do that unless they've got one of the reasons to do so. No, there's no ring of steel, Lydia, around Brisbane at this stage. We're doing what we've done all through this. We're working with our community. We are doing intercepts. We're being very high visibility on the roads. People can expect to see that. We want to keep people safe on the roads as well, so there'll be plenty of police out and about, and they can be expected to be intercepted at times. Oh, sorry, I don't have those figures. Maybe Health have that for me.
Yes. Yes, he spoke to me about that, and it was because they'd had some people who'd been in Toowoomba and they were just a bit concerned they'd come back. So we've got to remember that the Northern Territory is very, very high risk because of their high First Nations number of people and their high remote Indigenous communities. So he made a decision, which I totally support him. Well, we know that there was quite a large group of people from Toowoomba who came down to that pub here in Brisbane and then went back to Toowoomba. We've not had any positive cases amongst that group, but they were at one of the venues of concern. So that's why the Chief Health Officer in Northern Territory gave that advice to his government. But it's just been ultra cautious, and you would all know I'm always ultra cautious. He is as well, and he has even more cause for concern given the makeup of his communities in the Northern Territory. So it doesn't actually mean that I'm particularly concerned about Toowoomba, but it's an area we're looking at, as we are the entire state. Well, I need to see what venues have been involved in other parts of the states and whether we have any transmission in those venues before we'd look there. Oh, I need to see what venues and what cases there are.
Are there any locations beside Brisbane, Gladstone, Gold Coast and Byron Bay that should be on alert? Not that have cases, but where people may have travel?
Yes, there's a case in the Hervey Bay area that we're just looking at the moment. There may or may not be an issue there, but we're looking at it. As I've mentioned, we're looking at Toowoomba, we're looking at Gladstone, and we're working with New South Wales about Byron Bay and those people who travelled from Byron Bay back up through Gold Coast into Brisbane. We're looking at Gold Coast. So essentially the message here is that people should be on alert no matter where they are in Queensland. I don't think it matters whether you're in Gladstone or Toowoomba or Gold Coast. It's anywhere in Queensland because people have been very, very mobile since the 20th of March. And why wouldn't people have been mobile? So they've been out and about through the whole state, which is why I've asked that anyone who's been in Greater Brisbane, those 5 local government authority areas, from 8 a.m. on Saturday the 20th of March, no matter where they are today in Queensland, that they need to stay put and only leave the place that they are for one of those 4 reasons. That's really important. That's one of those cases related to the second cluster. Yes. It's a very, very big hospital. Metro South is a very large hospital and health service. So if they need more help, of course they'll ask for it and we'll work with them, but they'll probably be able to manage that internally. They're a very effective hospital. I don't know that there have been failures. The first one, there was absolutely no evidence. So remember, we use staff to work through with people as they're putting PP on and taking them off. So the first one with that doctor, there was no evidence of any breach, but clearly something happened because the genome was the same. So there's that one. The second one, she wasn't working with positive cases, so we have to work out what happened. But remember, we've only had that information from very, very late last night, so all of that is now being looked at.